Arkansas has taken a bold and visionary step toward reshaping its public health future by submitting a waiver request to the U.S. Department of Agriculture that would ban the use of SNAP benefits for purchasing so-called junk food, items like soda, artificially sweetened candy, and processed snacks made with flour. Governor Sarah Huckabee Sanders, backed by national health officials and USDA leadership, unveiled the plan this week as part of a broader movement to prioritize nutrition, improve chronic disease outcomes, and bring common sense back into federal food policy. And despite the noise from critics, this move may be exactly what a struggling food system needs: realignment with health over habit and nourishment over indulgence. For decades, SNAP, the Supplemental Nutrition Assistance Program, has existed to reduce food insecurity among millions of low-income Americans. But over time, it's become painfully clear that food security without food quality has created another crisis: massive taxpayer spending on nutrition programs that simultaneously contribute to chronic illness. Governor Sanders pointed this out clearly. Arkansas spends hundreds of millions treating Medicaid patients with diabetes and other diet-related conditions, while at the same time allowing SNAP dollars to subsidize the very products that exacerbate those issues. It's a vicious cycle, and this reform targets the root. What makes this initiative different is that it doesn't simply take food options away, it adds new ones. Hot rotisserie chicken, for example, long excluded from SNAP purchases due to outdated technical rules, would finally become eligible. That change reflects a refreshing shift toward protein and nutrient-dense foods that provide actual sustenance. A hot, prepared meal from the deli counter, especially locally sourced and protein-rich, is a far cry from a bottle of soda and a candy bar picked up at a gas station. In Sanders' own words, that's the definition of crazy, and correcting that kind of logic is not only practical, it's necessary. Supporters of the policy, including U.S. Agriculture Secretary Brooke Rollins and Health Secretary Robert F. Kennedy Jr., have tied it to the larger Make America Healthy Again agenda under President Trump's administration. It's an effort to refocus national food and health policy on prevention rather than reactive treatment. That principle is sound. We cannot continue pouring billions into healthcare for diet-related disease while our nutrition programs feed the problem. SNAP reform represents an overdue course correction. While some critics argue this restricts freedom of choice or unfairly targets the poor, the reality is more nuanced. SNAP recipients will still be able to purchase a wide array of foods: fruits, vegetables, meats, dairy, whole grains, and even snacks. What's being removed are specific products proven to offer no nutritional value and contribute to negative health outcomes. Skittles and soda are not meals. They're not even satisfying. And Sanders is right to question why public dollars should continue subsidizing these purchases under a program intended to support nourishment. The reform also reflects a broader cultural shift toward reconnecting food assistance with nutritional outcomes. For too long, we've allowed commercial food interests to dictate public health policy. Trade groups representing candy and soda manufacturers were quick to denounce the Arkansas plan, labeling it misguided and punitive. But that response is expected from industries that rely on maximizing profit at the expense of health. It's not misguided to want children from SNAP families to have healthier diets. It's not punitive to protect future generations from diabetes, heart disease, and metabolic dysfunction. There is also something deeply pragmatic about the way Arkansas has framed this initiative. By eliminating the state grocery tax, the Sanders administration has already made healthy food more affordable. And by pairing SNAP reform with Medicaid policy, the state recognizes that these systems must work together rather than in conflict. Christy Putnam, Arkansas's Secretary of Human Services, put it best: the same agency that runs SNAP also funds Medicaid. It's contradictory to spend in one program to fuel poor health and in another to treat the consequences. The reform is not just about nutrition. It's about fiscal responsibility, logical governance, and public accountability. Importantly, the state has ensured that this change won't reduce funding for SNAP, just what it can be spent on. That distinction matters. The poorest Arkansans won't get less support. They'll simply be directed toward food that supports their bodies rather than breaks them down. As Governor Sanders noted, it's not about taking anything away. It's about making sure taxpayer dollars serve the purpose they were intended for: feeding people in a way that promotes long-term health and self-sufficiency. There is, of course, a 30-day public comment period and a coordination process between the USDA and the state before this policy can take effect. But if implemented, it would impact nearly 350,000 SNAP recipients in Arkansas and potentially serve as a model for other states ready to move from health crisis to health recovery. Already, Indiana is pursuing similar reforms, signaling growing bipartisan recognition that food assistance should be part of the solution, not the problem. In a nation where 1 in 3 adults is obese and diet-related illness remains the leading cause of death, Arkansas's decision is not just a policy update, it's a necessary intervention. It's a step toward healthier families, smarter public spending, and a future where SNAP doesn't stand for short-term survival but for sustainable nutrition and progress. For other states watching, the message is clear. Reform is possible, and it starts with the food we put on the table.